akkamitti affect godha waan juuja as jala ilaallaa jechuudha. Tokkoffaarratti for drug be effective drugin tokko effective yookaan bu'aa barbaadamu san fiduu ni danda'a. Bu'aa qabeessa jechuu kan dandeenyu enough of it is needed to reach site yoo hanga barbaadamu san site of action isaa tana gahee bioavailability isaa 100% like drugs given by IV drugs are directed to the blood and 100% bioavailable. This means when IV yookaan meedha yookaan IV dhaan gizee kennamu directly into the bloodstream seelii dhiigaa keessatti dafee kallattumaan dhiigaa jechuudha. Karaa afaaniin kan fudhatamu kun ammoo bioavailability isaa xiqqoo ni irrata. Extravascular route don't guaranteed that will hold those will reach systematic circulation intact. Hingi jechuudha warri extra subcutaneous pure other than IV is not directly bioavailable to 100%. This means affected by some cellular membrane physiological and chemical physiochemical property of the drug and another route. So stomach gastrointestinal content stomach garaachinii fi marrimaan small intestine waan jiru waan laallo jechaadha. Stomachiin garaacha keessa acid cimaa jira, hydrochloric acid found in stomach and it's important small intestine is only by the most of the important for basic drug tablet granule fine particle dissolution drug in solution absorb intact drug liver is bio first pass effect first metabolic effect of hepatic by hepatic vein that absorb drug is to be affected by this drug and the intact drug in systematic circulation and the pharmacologic effect. Then small intestinal content pages 5 up to 7. Then tablet and granule into granule into fine particle dissolution drug in solution. Then we absorb intestinal metabolism metabolites first in the urine can be formed by small intestine. The onset, intensity and the duration of therapeutic effect of most drugs depend on the different factors. Onset insa intensity insa akkasumas duration therapeutic effect inni fiduu qabu suni dawaa irra caalaa ta'anii faaktaroota adda addaa irratti hundaa'aa faaktaroonni irratti oral absorption mainly factor affect warri faaktara kana irratti dhiibbaa fiduu danda'an keessaa muraasni oral absorption irratti physiological factor is first and the second is physiochemical factor. The third is formulation dosage form of factor that is see by one tokko tokko laalla jechuudha. This factor play important role in bringing the drug to the biological site in the body quantity required. Faktoriin kun gaheen guddaan inni taphachuu danda'u maalidha? Dawaan san akka biological site yookaan action site of action required bakka barbaadamu san gahu jechuudha. Hanga dawaa hanga barbaadamu quantity hanga barbaadamu wajjin bakka san akka gahu keessatti kana hubachuu illee waan adduus fayyadu sustaining it at that concentration for desired length of time. Hangam takka tura concentration kun desired length of time. Getting the drug out of the site after has performed desired effect, how to stay, and then when can reach systemic or site of action, how to reach, how to long time to stay in this see by in this topics. Physiological factor affecting oral absorption is one. It is important to understand the physiologic and the pathologic factor affecting drug absorption for proper drug product selection. Barbaachisaadha jechuun physiologic isaatii fi pathologic isaa faaktaroota affect godhan drug absorption kana proper drug sirrii kana filachuun barbaachisaadha jechuudha. Systemic availability and the onset of drug action are affected among other by blood flow to the administration site. Blood flow and systematic affected to danda'a jechuudha. Physiochemical characters of the drug and the drug product amala drug isanii fi drug product oomisha akkaataa oomisha pathophysiologic condition at absorption site Any pathophysiologic affecting ni jira waan jiru ilaaluun barbaachisaadha jechuudha. Then GI physiology of gastrointestinal tract are different one by another major segment. GIT different from one another. Anatomical and morphological difference in this GIT system with respect to secretion and pH. This has different form of this GIT tract is very important to see by one at learned by physiology of GIT as I learned the normal physiologic process of GIT may be affected by diets, content of the GIT hormone and the visceral nerve system, and these drug is affected by many affected by the GIT kun hedduudhaan affect ta'uu danda'a. Diet tokko nyaata tokko content of GIT isa waan jiru jechuudha. Uumamtaa waan keessa jiru hormooniidhaan akkasumas visceral nerve system visceralii ta'e kanneen keessa jiran kanneen worked by other parts of organ and dhukkubaa fi akkasumallee diraagii ta'uu danda'a jechuudha. GIT waliin maal fakkaata? Concept of four principal structural layerii baqqaana afur qaba. GIT waliin kuni duraa mucosa inside this is mucosa is inner to part of this, and then sub mucosa is covered by mucosa, and then other is muscle layer, and serosa is another outer layer of this. Okay, outer layer by parts of this have many physiological important. Outer layer of epithelium provide structural support to organ. Structure isa eeguudhaaf gargaara jechuudha. Outer part of epithelium eeguuf fayyada jechuudha. Muscularis extrema contain two layers of smooth muscle. Outer longitudinal layer short tag, and which is important to mixing the propulsive movement of GIT content. That's found in that means muscularis extrema is circular muscle and longitudinal muscle that's found in that area, around that area. This is important for this. Okay, is movement of drug, mixing in the propulsive movement of the drug to move drug in the another part of is important body in food. Another part is this can be moved through is thicker inner circular layer. Thicker means inner circular side layer. Thicker is very large, very wide. Prevent food traveling backward. Akka if boodan deemne dhorkachuu nyaata foodiin akka boodan deemne dhorkachuu isa mukusaan layer of connective tissue dha supporting mukusa and the joint to it underlying the muscle. Richly supplied with blood and the lymphatic vessel and the network of nervous system. Mucosa is composed of three layers. Mucosa three layers kaba muscularis, mucosa, lamina propria, epithelium. Epithelium is selective for absorption, selection, and protection function is very important for epithelium. Epithelium is where it's found. Epithelium is where it's found. That is that okay, that place. So in that place, very important to this site. Okay. 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 So very important to these topics. Okay. Then can be different parts of the layer found in that area. So in that place, very important things about mucosal layer is very important to this function as mucosal layer. Which parts of mucosal layer found in that place? To mucosa is first one is epithelium. Epithelium is that place found in that area. Okay. Lamina propria means that found in there. Okay. There. Okay. Muscularis mucosa is found outer layer in that place. For very important to use very important to use. Okay, we understand for understanding to different parts of this mucosa. Our topics about factor affecting drug absorption of oral absorption. drug factor affect warreen godhuu danda'an keessaa jenneeti ilaallaa jechuudha. Tokkoffaa irratti immoo wanti ilaalaa jiru epitheliumidha. It is covered by layer of mucus. It is covered. Epitheliumiin kun covered ta'anii jiruun maaliif inni mukusaadhaani. Mukusaatu cover godhee jira jechuudha epithelium kana. This yeah, understand this, okay, very understand. Then it is serve as protective layer and mechanical barrier, okay. Serve as protective layer baqaana ittisuutu waa dhorku fi akkasumallee mechanical barrier akka wanti garagaraa keessan dabarre wanti dhorku jechuudha. Is constantly changing mix of secretion and explode cell. Constantly jijjiiramaa jechuun mix wal godhuudhaaf waan wal secretion dhufu wajjin mix wal godhuu fi explode cell kan ta'an componentin mukin is largely componentii mukin jedhamu keessaa qaba. Kunis mukin kun mukin and water and mukusa is water around 95% and mukin largely glycoprotein parts is only 5%, around 5%. Mucosa layer 5 micrometer and up to 500 micrometer with 800 micro averages. Meter average esophagus is another part of the serve to move bolus of food, drink, of drug formulation from the buccal cavity through the lower esophagus sphincter and into the stomach. This is, when ingest or food or drink or drug, different parts of them can be eat that can move to the up to esophagus through esophagus and can reach to stomach. This means mouse up to stomach is between them found in this is esophagus. Esophagus is very important for ingested material having very short contact time with esophageal tissue. So it is 25 centimeter long, around 25 centimeter long. This part up to this, okay, up to stomach. Stomach is found about left side of this part, okay, on this part. So up to this is 25 centimeter long and diameter is 2 centimeter. Lined with stratified squamous epithelium. Stratified means stratified, we have learned about physiology, but the lowest 2 centimeter and lined with gastric mucosa. Patch of normal esophagus lumen is between 5 and 7. Is in upright position, transmit material assessed by gravity. Esophagus transmit drug formulation, dosage form tablets. Limited biopharmaceutical important of dosage form. Stomach is several function. Stomach is reservoir of food, act as reservoir and nyaanni tuqubamee turu jechuudha garaacha isaa. Process into the fluid time bakka itti dhumatti itti jijjiiramu jechuudha. Absorption of nutrient from sign karaan itti absorption itti gaggeeffamullee icha keessatti jechuudha. Absorption gadi nyaanni hundi kudaafamee gara cumaatti taa'ee gara icha keessa turaa tokkoo fi itti regular delivery of food